Imagine 150,000 people fighting for just 774 spots. This is Kenya News Update today. Coming up, you'll discover the shocking odds young Nigerians face for a chance to serve their country and what this massive competition reveals about the future of healthcare across Africa. The Federal Ministry of Health and Social Welfare just began final interviews for its National Health Fellows Program 2. Over 150,000 applicants. 774 positions. That's a selection rate of roughly half of 1%. For context, that's more competitive than getting into Harvard. But here's the twist. This isn't just another job hunt. This is a nationwide talent search to place one young leader in every single one of Nigeria's 774 local government areas. Meet the hopefuls. Young doctors, nurses, public health graduates. They're not just vying for a job. They're competing to become grassroots architects of Nigeria's health system reform. The program promises a platform to observe, learn, and actively shape national health policies from the ground up. The stakes? A chance to build a career while rebuilding a nation's healthcare infrastructure. But here's what nobody's talking about. The sheer scale of hope versus the brutal math of opportunity. 150,000 dreams funneling into 774 slots. The journey to this final interview stage has been a grueling marathon. According to a statement from the program's coordination office, the process was rigorous and merit-based. It combined digital screening, shortlisting, and now, in-person state-level interviews. And then, something unique happened. The interview panels weren't just government officials. They included representatives from the World Health Organization, state ministries of health, academia, local government associations, and even traditional leaders. This cross-section of society was designed to ensure fairness and transparency. But here's the part that will blow your mind. The coordinating Minister of Health, Professor Ali Pate, called this process part of our nation building. He commended the extraordinary interest and reaffirmed a commitment to selecting the finest candidates. The Minister of State for Health, Dr. Adekunle Salako, described it as a new model for talent discovery. He said the integrity of the process would ensure only the most committed are chosen to lead change. And the Permanent Secretary, Kakalam Daju, emphasized this program institutionalizes transparency in public service recruitment. The selected fellows will undergo residential training in Abuja before deployment. Their mission: to champion innovation, accountability, and community-driven health interventions in their home LGAs. This is a seismic shift. But here's the lingering question the program itself cannot answer. What happens to the other 149,226 applicants? The ones who showed up, who were qualified, who had the passion to serve but lost the numbers game? The implications are massive. On one hand, this overwhelming response shows a generation desperate to contribute, to lead, to fix broken systems. It's a reservoir of national pride and potential. On the other hand, it highlights a critical shortage of such transformative opportunities. Some see a brilliant model for equitable leadership development. Others see a system where hope vastly outpaces capacity. The tension is clear, a flagship initiative changing lives for a lucky few, while an ocean of talent waits for its turn. But if this program succeeds, it could create a blueprint for the entire continent. Do you think this ultra-competitive fellowship is the best way to build future health leaders, or does it risk leaving too much potential on the table? Drop your take in the comments. Subscribe to Kenya News Update today for more stories shaping our future.